Good afternoon, everyone. We are back again with yet another insightful and engaging Facebook Live session by Sharda Hospital, Greater Noida. I am Dr. Namika, Senior Resident in the Department of Medicine, Sharda Hospital, and I'll be hosting this informative session. With us today, we have our expert, Dr. Anil Thakwani, who is a Director and Senior Consultant in the Department of Oncology, Sharda Hospital, Greater Noida. Thank you for joining us, Dr. Thakwani.
Thank you, Dr. Anamika, for inviting me for such a great initiative. And a very good afternoon to you and all my Facebook Live audience.
You're welcome, sir. Before we start this session, let me introduce Dr. Thakwani to all our viewers. Dr. Thakwani has more than 25 years of experience in the field of oncology. He is a well-known oncologist in Delhi NCR region of India. He ensures great efficiency and safety while performing different kinds of procedures. Sir keeps himself aligned with the latest developments in his specialty, and today in this session we'll be discussing cancer screening and early detection in India. So, Dr. Thakwani, please enlighten us and tell the audience about the basic information about cancer and how do we detect the cancer in the early stages.
Yeah. So nowadays, as we all know, that cancer is in every family. Okay, it's so common. So there are different type of cancers. The number of organs which are present in our body, the same number of cancer can be there. Okay, so basically, so as we know that a lot of cancers are there, and the treatment of the cancer is one of the difficult thing, but it's not impossible. And it's difficult only when it is found in a late stage. But if it is found early, the cancer, 60 to 70% cancers are curable, and we can definitely cure them, and that too at a very low price. So our aim, and a government of India and all the governments of the world, the aim of the government is to catch the cancer in a very early stage, and for that we need to do certain tests, and which is commonly known as screening.
Okay, so what causes cancers in India?
So basically, different cancers, the cancer in different organ, the causative agents are different. Suppose if we see the oral cancers,
Yes.
most common cause of the oral cancers is the tobacco chewing. Okay, tobacco is a main culprit in that. So as we find this type of oral cancers in the North India region, so a lot of people consume tobacco and all, and fortunately, in Punjab, this cancer is very less. The reason is because people don't consume tobacco over there. Like because of the religion, Sikh religion, they don't take the tobacco. So the oral cancers are very less in that area. So just like if we talk about the lung cancer, most of the people who smoke the tobacco, not chewing, smoking, because smoke goes into the lung and causes cancer. Similarly, if we see the GI cancers, gastrointestinal cancers, cancer of colon, cancer of food pipe. So the causative agent is high fat in a diet. Okay, high fat in a diet, low roughage. So like most of the people eat the fast food. So fast food contains high fat, high carbs, and it has low roughage content and protein content. So it is one of the causative agent for the cancer. So taking alcohol causes the cancer of food pipe. Medically, it is known as the esophagus, and consuming beer causes the cancer of rectum and anal canal. And just like these are the few reasons. There are a lot of other reasons, like in melanoma, most of the sun-exposed regions, like the area where the sun rays are directly there, so it causes the melanoma. So there are a lot of other reasons also. There are certain like genetic reasons also for a lot of cancers. So we'll discuss one by one.
Yes. So can we inherit cancers? Like, are cancers genetic in origin?
Yes. So few of our cancer, like 10, around 10 to 20% of the cancer can be inherited, and most of them are not inherited. So the cancer which are inherited, so how we can know that cancer is inherited? So most of the time what happens, like it occurs in the very early stages, and we can see a lot of cancer cases in one family. So we should suspect that there's some inheritance, and we should do the test accordingly.
Okay. So, what are the symptoms like patient will present to us in OPDs? Like you must be seeing a lot of cases. So, most of the patients, what are the complaints they come with?
So basically, that's a nice question, Dr. Anamika.
Yeah.
Basically, most of the, I think most of our Facebook Live audience would also like to know about this thing. So it all depends upon the area where the cancer is arising. Okay, suppose if it's a brain tumor, so brain, you know that the brain has a very limited space. So when the brain tumor arises, that space is occupied and it causes some special symptoms like vomiting, recurrent projectile, early morning vomiting, and severe headache is there, which is not subsided even by the normal painkiller. So we should suspect, or there may be some seizures, and there may be some the paralysis of the limbs, of lower limb or of one side like one hand and one lower limb leg, they are paralyzed. So we should suspect cancer in that area. Similarly, if there's breathlessness is there, or there's blood in sputum, then we should suspect cancer of lung. Or there may be the difficulty in swallowing, we should suspect cancer of esophagus, that is food pipe. So different cancers, they give different symptoms.
And so, what are the screening tests that are available in our country to detect these cancers at the early stages?
Yeah. So again, this is a nice question, because as we know that screening tests are not available for all the cancers. Basically, there's a term called lead time. Okay, the cancers in which in which we get benefit in a form of the curability of the patient, or in a form of the amount of money which is being consumed in the treatment. So that type of cancers are the only cancers in which we get benefit of the screening test. So that means the lead time of that cancer is more. Once the lead time is more, then if we catch the cancer in an early stage, then we get benefit of longevity of life, curability of that cancer, and of course we pay less in treating that cancer. So there are few cancers in which we get all these advantages, and these cancers are there in which we do the screening test. These are commonly like breast cancer is there, and the cancer of cervix is there, lung cancer is there, and similarly few more cancers are there in which we have a good lead time and we get benefited in a form of, like, we can cure the patient, we pay less in treating the patient also get less symptoms, less pain is there, and less complications of the treatment are there.
So, sir, do all cancers require chemotherapy? Like, is that the modality of treatment for almost all the cancers?
Yes. So basically, cancer can be treated by few modalities. We all should know, as a general public, we all should know that the first modality is the surgery, then chemotherapy, then radiotherapy. Now there are a lot of other medications which are added in the medical management, like immunotherapy has been added, hormone therapy has been added, target therapy has been added, and soon certain other therapies are being coming. But as we know, all the three modalities, they should be used very meticulously while treating the patient. Okay, the doctors should be well experienced, because not in all cancer all the three modalities are used. If the cancer, like for example, I'll tell you, like in cervical cancers, which is very common. What is cervix? Cervix is basically a opening of the uterus. Okay, so it is very common in females in India and other developing countries like African countries and all. So in that, there's a misconception like if surgery is not done, we may not be saved. Okay, so this is a very well example of the organ preservation. Here, if the stage is up to 2, okay, or 2 or beyond stage 2, then there's no role of surgery. We can cure the patient with the help of radiotherapy and chemotherapy, and that 70% of the patient, 80% of the patient are cured if they are found in a stage 2. But if it is a very early stage, yes, then we can do surgery, and there's no role of radiotherapy and chemotherapy in most of the patients. But sometimes when there are certain number of patients, like only 5% in a very early stage, which needs other adjuvant treatment like chemotherapy and radiotherapy along with the surgery. But if we talk about stage 2 onwards, then only chemotherapy and radiotherapy can cure the disease. So this is one of the example of preserving the organ. We are not losing any organ. Like uterus is there. If patient is young, she can get pregnant in the future. And after the treatment, 80% of the patient, they get good response and they are cured. So this is one of the burning example for those who have a misconception that once cancer is there and it cannot be cured.
So we keep reading and we keep hearing this thing, stages of cancer. But our viewers, they want to know what exactly are these stages of cancer? How do we stage cancers?
So basically, different cancers are staged differently. Most of the time, we do the TNM staging in all the cancers except the gynecological cancers, where we use the FIGO staging. Okay, these two are the different type of stages. I don't think so that normal public should go in detail in that stages, but I will definitely tell you that why we stage the tumor. Basically, we stage the tumor on the basis of the treatment response. Like in stage 1, the response will be good. Stage 2, response will be less good. Like as we go forward in the stages, and the treatment response goes down, and the treatment modalities which we are using to treat the patient, they differ in all the 4 stages. That is why, and of course prognosis wise also, the prognosis goes down once the stage is advanced stage. So in some cancer there are more than 4 stages also, like 5 stages, 6 stages. In few of the pediatric tumors we have 6 stages also. So the stage means, the stage tells us, one is a prognosis, other is what treatment is to be done, and third is how much it is spread. Definitely it tells us that thing.
Okay, so according to you, which are the most common cancers in India? And especially like in men, which cancers are very common, and in females, what cancers do you see the most in our population?
Okay, so that's again the nice question asked by Dr. Anamika. Basically, like we divide the world in the developing world and developed world.
Yes.
Okay, so if we talk about our country, it's still developing, so we come under the developing world. So we may say that in India, part of the world is developed and part of the world is still developing. So the area in our country which are still developing, which are backward, who do not maintain the hygiene and all, so most of the time cervical cancers are very common in that area. So if we see the villages or some African countries, backward African countries, or backward region in our country also, and the females who are not maintaining their hygiene, so cervical cancers is very common amongst them. And if we see the developed world, then again the breast cancer is one of the common in the females. The reason of breast cancer getting very common in females in the developing world is the food habits. So nowadays in the developed world, the females have started smoking, females have started taking alcohol, and most of the females, they are not taking the normal food. They are going after this Domino's and all, and this fast food which contains extra carbohydrates, extra fat. So all these give rise to the cancer of breast, cancer of colon. So that is the reason breast cancer is very much common here in the developed areas, and cervical cancer is in developing areas. So this was for the females. If we talk about males, so again males, most common cancer is again the lung cancer, because of the pollution, because of the cigarette smoking or BD smoking, I mean tobacco smoking. So in males, lung cancer, followed by oral cancers and GI cancers.
Okay. So like you just spoke about breast cancer, which is very common in our country. So what are the various screening tests that are available in our country for the breast cancer?
Okay, so again breast cancer is one of the cancer which can be screened very well, and we can take a good advantage after doing this screening. So basically screening of the breast can be done with the help, mostly it is done with the help of mammogram. Mammography is a modality which can help us in screening the breast, but in some cases who are at high risk or in which mammography is inconclusive, we can also go with MRI mammography. Okay, this was a X-ray mammography, MRI mammography, and this is for the females who are above 30 years of age, in which the breast is lax. But the young females who have a good family history, that means high family history, and there's some breast lump is there, or even if the breast lump is not there, and if we want to screen in a very early stage, a very early age, then we need to do the ultrasound mammography in those patients, because most of the time in X-ray mammography we can't find anything. Ultrasound mammography helps in the dense breast basically.
So we see a lot of doctors advising biopsy for these patients. So is biopsy only done for cancer patients, or is there any other role of biopsies?
See, basically before biopsy, we all know that it's an invasive test.
Invasive procedure.
People are afraid of getting, and why to do biopsy? Why to do invasive test? Again, it has other complications like bleeding. It can have infection, so septicemia and all. So what we do whenever we have a suspicious lump, we do the mammography. In mammography, there's a categories of the tumors which are there. Okay, so most of the time, all breast lumps are not cancer. So no need to worry for that. Once you have a breast lump, 70% of the breast lumps are non-cancerous. But that doesn't mean that you should take it easily. Okay, you should always contact your gynecologist or oncologist. Go with them, get the clinical examination done, get the mammography or few other tests which your doctors tell you. You get it done, and again mammography usually is being done if mammography is a very low grade. It is called the BI-rate categorization. So if it is a BI-rate 1, 2, 3 or even sometimes 4, no need to worry, we can have a follow-up. Okay, but again if it is a BI-rate 5, BI-rate 6, it is 90% it can be malignancy. So by getting the mammography done, we can very easily know whether that patient is suitable for biopsy or not. So not all breast lumps should get the biopsy done. Only few of the breast lump, I think that 10% of the breast lump need biopsy, otherwise they don't need biopsy. And most of the time the breast lump is fibroadenosis or fibroadenoma. This is simple disease. It can be taken out by doing small surgeries. No treatment is needed because it's not a cancer. Okay, so no need to afraid.
Then so we have few questions from our viewers as well. Like Priyanka has asked that is hair loss linked to cancer? So all people are having a lot of hair fall these days, especially post-COVID era. So they have this major concern that if they're having a lot of hair fall, they detect cancer and should they go for blood tests?
Never. See, basically hair loss and cancer has a relation. But if the people are having hair loss, that never means, not even 0.5% means that you have a cancer. Hair loss has nothing to do with the cancer. But yes, if we are getting chemotherapy causes hair loss. Okay, once the patient is diagnosed and then we have started the treatment, then definitely some chemotherapeutic agents, like around 40 to 50% of the chemotherapies, they do hair fall. But if you are having hair fall, that doesn't mean not at all that you are cancer. Cancer can never do hair fall. But yes, treatment of cancer, that too only few percent, like 30 to 40%, they can cause hair loss.
So another viewer, Rishabh Gulati, has asked that are all cancerous tumors hard or they are soft? How do we know whether it's a cancerous growth?
Okay, so Mr. Rishabh, that's again the nice question. Most of the time the cancerous growth, they are hard, they are friable, they bleed on touch, but it needs a good experience of around 20 to 25 years like me. So to know by seeing the cancer or by feeling the cancer that it is cancerous or not. So whenever there's any lump, you should always be suspicious of that lump. You should definitely contact your doctor so that with the help of his clinical acumen, he can guide other investigation to confirm whether it is cancerous or not cancerous.
So another viewer, Niharika, is asking a question that how do we detect bone cancer? How do we know what are the symptoms that she will be suffering if she's detecting herself as bone cancer?
Bone cancer.
Yes.
So, Anamika ji, basically bone can have cancer by two types. Okay, one is when the primary tumor is in the bone, like cancer has originated from the bone, or it can also be like it has originated from breast, it has originated from colon, your food pipe. So metastasis can also be there. So it is also a cancer. So these two things are very different, because if it is arising primarily from the bone, then it can be stage 1 or it can be stage 4. But if it has come from some other area, it is it is stage 4 disease. So whenever there is a bone cancer or metastasis in the bone, you feel a severe pain. Okay, sometimes only like 5 out of 100 patients may not have pain in the very initial stages, but most of the time it's pain, it's fracture. Even if you are walking, patient may fall down. I've seen a lot of patients who see a breast who has metastasized to the your thigh bone called femur, and they fall down while doing the routine activity, and they are diagnosed with breast cancer, metastatic breast cancer, after they fall down. We do the investigations, we can see the lytic lesions of the bone, and when we investigate, we do the PET scan, we find a good growth in the breast for which patient has never complained of.
So Mr. Anuj is asking that, okay, is chemotherapy painful?
Yes, Mr. Anuj, that is again a myth amongst the patient that chemotherapy is painful. Chemotherapy is never painful. It is just like when you are getting IV fluids, okay? Yes, there are certain side effects. So during chemotherapy, most of the chemotherapy, they don't have side effect. But definitely, yes, chemotherapy is meant to kill the cells. Okay, we take advantage of that, like it kills the cancer cells more and normal cells very less, like cancer cells 100%, normal cells 5 to 10%. So if your normal cells are also dying, you will have a hair loss, you can have a diarrhea when your intestinal epithelial cells are going down. So there are certain side effects that are very well manageable. Okay, so it doesn't cause any pain, so it's a myth. You please contact your doctor. If unfortunately, if you have any patient who is near and dear to you, he'll explain more. Or you can come to us in Sharda Hospital. We are having full-fledged facility, and you can see our patients how they are getting the chemotherapy.
Sir, our viewer, Miss Monica, wants to ask, what is the age at which she should be scared of breast carcinoma? What is the age at which most of the patients of breast carcinoma are coming to you?
Okay, so age. Most of the time the age is above 40, 50 years. But as I told you initially, like breast cancer can be inherited also. So if it is inherited, then it can occur in early stage also. Early as 15 years. I've seen a lot of patients 15 years, 20 years, 25 years, 30 years. So, and unfortunately, the biology of the breast cancer in young is very severe. If the patient is young, it is most of the time triple negative. Triple negative is a type of breast cancer. There are a lot of different type of breast cancer, and that is treatment resistant in most of the time, and there are more chances of recurrence in that. So breast cancer can occur at any age. If you are having family history, you should be screened. You should get yourself screened very well in early stages only, because you have few % of chances of getting the cancer, and if it occurs in an early stage, then it's severe and it's very much virulent.
Okay, so Mr. Nishant wants to ask that is every breast lump carcinoma? Or how will we diagnose that if this lump is a cancer?
So as I told you in my previous question also, like only 10 to 20% of the breast lump are cancer. 80% of them are never a cancer. They are the fibroadenoma. They can be abscess. They can be fibroadenosis. So most of the time it is not a cancer. So once you get, I'll request all my Facebook live audience, especially the female audience, whenever you get lump in your breast, sometimes it's very difficult to feel the lump in a breast. So weekly or once in 15 days, you should do self breast examination, even if you are normal. Okay, by doing the self breast examination, you can know on the internet how to do it's very simple process. So you should do the self breast examination. Whenever you are having any lump, directly go to your gynecologist or oncologist, and as I told you, 80% of the time it is not cancer, but still you should be aware of 20% of the time, because again cancer is cancer. So when by feeling it, you cannot know, and at least you cannot know, but your doctor can know. Usually fibroadenomas or fibroadenosis, they are the breast mouse. We commonly call them breast mouse. Why we call it breast mouse? Because if you will try to catch it, they'll slip you with your hand, it will go to the other side. So it's like that. Most of the time these type of lumps are fibroadenoma, nothing to worry, but you should always contact your doctor to see this, because they are having a good experience to differentiating between these two. Still, once they differentiate, still they go with other investigations, so that we may not miss the cancer even for 0.1% also.
So talking about vaccines and cancer, there are many vaccines which are available. Even our viewer, he wants to know that what is the vaccine which is available for cervix cancer. This is Mr. Nishant's question to you.
So, Mr. Nishant, see, basically, vaccine is not meant for the cancer. Few cancers, they are caused by infection. Like cervical cancer, it is caused by the HPV virus. There are few types of HPV virus. HPV is a human papilloma virus, which causes chronic inflammation of the cervical epithelium and causes cancer. So we vaccine the patient against that virus. So 50% of the time that cancer goes away. So after getting vaccination also, you are not 100% cured. You are 50% cured, because other 50% they are not caused by virus only. Okay, there are some other reasons also, but definitely 50% you are cured of not getting the cancer. So in cervical cancer, we do have that type of vaccines which are easily available of different types. Few vaccines are very cheap because they only give us protection for against the one or two types of virus, but few vaccines are very costly because they give you protection of more number of viruses. Similarly, hepatocellular carcinoma, that is cancer of liver, that are most of the time that hepatocellular carcinoma is secondary to hepatitis B, hepatitis C. So there are vaccines against hepatitis B and hepatitis C, which can protect you of getting infection of hepatitis and B and C, and indirectly they'll help you in getting protection against the liver cancers also.
So another viewer of ours, Mr. Rahul Rastogi, he wants to know why prostate cancers are becoming so common these days.
So there are again a lot of reasons behind why prostate cancer are getting common. First of all, these prostate cancer were earlier also, but we were not having that modalities like PET scan, PSMA PET scan, which is specialized PET scan, which is used to detect the CA prostate. And the best part of that prostate cancer is it rarely affects the young people, it affects the older people. So people were not able to know. People used to think that he has died a normal death and like that. So it was common earlier also, but now also again it can be inherited. Second thing is, again, there are like chances of the, like I told you, food habits. Our food habits are going bad day by day. So we have decreased the roughage in our diet and have increased the fats in our diet, alcohol, and even indirectly some tobacco is also responsible for this cancer. So all these are the reason. If we avoid these all these causative factors, definitely the chances of getting different type of cancer, including prostate cancer, will go down.
So another viewer has asked, is prostate cancer related to reduction in our bone strength?
Yes. So it has nothing to do with the bone strength reduction or like that. Why people call this? Because most of the time prostate cancer metastasizes to bone. So most of the time you can see the lytic lesions. Most 90% of the patient, they are diagnosed when they get bone metastasis. That is when the patient is in stage 4. So they are diagnosed when we see they comes to us with the bone pain. We do the scans and all. We see the lytic lesion. Then lytic lesion are again in lot of malignancy. But because of the experience and the age, looking at the age of the patient, we do the tumor marker known as the prostate specific antigen. If it is increased, again it is increased in benign prostatic hyperplasia also and cancer also. So we need to do the PSA velocity and different other tests to differentiate between these two things. And again we do the multi-para MRI, in which we will have a suspicion whether, just like we are doing mammography in CA breast, like MRI, multi-para MRI is being done in the CA prostate patient in order to differentiate whether it is a benign, that is non-cancerous enlargement of the prostate, which is almost in 90 to 95% of the cases, and we need not to do any significant treatment for that, and it can differentiate both cancerous and non-cancerous swellings of prostate.
So as we know that the use of cell phone is so common, even the kids are in today's generation, even a 3-year-old kid is using cell phones. So one of our viewer, Mr. Subodh Sharma, he wants to know that can the excessive use of these cell phones are also associated with cancers?
See, basically, it is a hypothesis. It has not been proven till now. Okay, but there are high chances that the cell phone radiation may cause the brain tumor. There are high chances, and there are certain papers also who have mentioned this thing. So this can be a risk factor for the brain cancer, especially because we most of the time we hear the phone while applying it near our brain. So the best part is that do not use your cell phones when you are in the area where the signals are very low, because during that time we get a lot of radiations, and most of the time better it will be like you should insert the headphones and then use the headphones, then it will be away from your brain. Never ever sleep with your cell phone nearby. You should keep your cell phone outside your room if you are you are relaxing yourself. So these are the factors. You should take the precautions, and definitely the chances of the different cancers which are caused by this, it has not been proven. Again, I'm telling you, but still, why to take the risk? You should take these precautions, and definitely the chances will go down.
Yes. So another viewer of ours, Mr. Mohit, has asked that what are the various modalities which are being offered at our hospital for the treatment of cancer?
So, as I told you that cancer can be treated by the chemotherapy, by target therapy, hormonal therapy, immunotherapy, surgery, radiation therapy. We have access to all this treatment. So we are treating patients with all these modalities. Even the government of India has started the scheme of Ayushman Bharat. So a lot of patients are getting benefit from that scheme under us. So we are treating all sort of patients with all the tumors, and soon we are coming up with a very big cancer hospital in which we will be getting more specialities like bone marrow transplants and all. So within 6 months to 1 year, definitely we will be adding bone marrow transplants and hematology department with us.
Thank you so much for telling this information, important information. I hope you have noted down, Mr. Mohit. So another viewer, Pawan, has asked us that what is the earliest age at which prostate cancer can occur?
Okay, so again, if it is a hereditary, it can occur at early stage like 15 years, 15 to 20 years. But most of the prostate cancer are adenocarcinomas, and we usually talk about them. But there are very, very rare variety also. When I was in the All India Institute of Medical Sciences, there I saw few patients, like they were pediatric patients. They were of 1 year of age. So they had a rhabdomyosarcoma of prostate. It's a rarest variety of cancer prostate, and the treatment is totally different in that. Okay, in the adenocarcinoma prostate, which occurs in older people, most of the time we give radiation and hormone therapy if it is a localized disease. Sometimes we do surgery also, but the thing is that, as I told you, that prostate cancer is usually in the age of more than 80 years. Most of the patients, they are not suitable for surgery. But the best part is that with the help of, again, the organ preservation applies to this cancer also. We have a similar cure rate with the radiation and chemotherapy also, or hormone therapy also. Okay, so we give most of the patients are being treated with the radiation and hormone therapy, and they become all right. Few patients, they are subject to surgery also. But in rhabdomyosarcoma, chemotherapy plays a very good role, surgery and chemotherapy, and definitely with the when radiotherapy, all the three modalities are being given. Their patients are treated with all the three modalities there. So as we know that children like of 1 year or 2 years, they are getting, so we should getting this rhabdomyosarcoma. So we should not leave any stone unturned while treating the patients.
So before we end this session, my final question to you: are cancers cured? Can they completely cured?
Yes, again, this is a very nice question. As I told you, most of the cancer who are at a very early stage, or even like in CS cervix, even if it is in a stage 2 or stage 3, most of them, they are cured. Okay, there are a lot of patients like who are cured, and I have treated them, and there's one organization, Cancer Sehog organization. The best part of that that organization usually helps the poor patients on the recommendation of the doctor. We are associated with them, and the best part which I like about that organization, like the people who are managing that organization, that are the people who have been cured by the treatment. They have been cured by the cancer. So 100% people who are working and are running the organization, they are cancer-free patients. Like they are cured from the cancer after the treatment. And there are thousands of people who are doing job. So whenever you get some confusion about that cancer cannot be cured, you please go there and be a part of them, help them, so that we can cure more and more poor patients of cancer who are not able to get the treatment.
Okay. Thank you so much, sir. Thank you so much for sharing such important information for our audience. I'm sure that they must have got most of their answers regarding cancer, and audience has got a lot of information that they've been looking for. Thank you so much for this session.
Thank you, Dr. Anamika, and thank you, my Facebook Live audience, for a nice session. Thank you.
Thank you.